Now it turns out that may not be so. Late last week, Tymkiw got a disturbing letter from the hospital. The person who administered her pain medication wasn't a nurse. That person, allegedly Brigitte Cleroux, police say was posing as a nurse.
Brigitte Cleroux was entrusted with the lives of highly valuable patients, but her career is a 3-decade trail of stolen identities, forged documents, and a staggering medical deception that ended with a judge basically declaring her needles as weapons. The woman trusted to care for over 1,000 people was actually a serial imposter who was never a registered nurse at all, and her entire story was exposed in a single letter. It is a chilly Thursday evening on December 2, 2021, in the province of British Columbia, Canada. A woman named Sasha Tymkiw is relaxing at home when she checks her mail and finds a letter. At first glance, it looks like an ordinary piece of mail. The date on the front is November 29, and it comes from the Provincial Health Services Authority, or PHSA. The PHSA is a provincial health authority that operates specialized health services in British Columbia, including BC Women's Hospital. For Sasha, getting a letter from the health department does not seem like a big deal. Only a few months earlier, she had gone to BC Women's Hospital for a surgery to remove a small growth, a polyp, from her uterus.
I was in a very compromising position. Obviously, I was very vulnerable and nervous.
Sasha assumes the letter is just a standard follow-up or maybe a survey asking how her hospital visit went. Sasha tears open the envelope and starts reading. The letter tells her that the hospital recently discovered that a person they hired to take care of patients did not actually have a valid nursing license. Even worse, the letter says this fake nurse was the exact person who personally took care of Sasha. Sasha is understandably completely shocked and tries to remember her time at the hospital, wondering exactly who this fake nurse was and what they did to her.
At BC Women's Hospital, she remembers a nurse who was loud and condescending and made her feel uncomfortable.
I just had to say, it's okay. They do this all the time. These are professionals.
Sadly, Sasha is not the only person who gets this terrifying news. One patient, Paige Morris, also received the exact same letter.
I was going in for a surgical abortion. I remember that she was really rude, she was really condescending with the other people that were working.
Meanwhile, another patient named Vanessa Sawrey received the same missive. At the time, she needed medical help when an IUD had gotten lost inside her body and needed to be safely removed.
I had an IUD that had gone rogue, disappeared in my body. This individual was involved with your care you received, but I don't remember which nurses I had really taken care of me because I was completely out of it.
Both operations were incredibly scary and deeply personal moments for both Paige and Vanessa. And finding out that their caregiver was a total fraud felt like a massive violation of their privacy and their bodies.
To find out later on that one of my caregivers was not actually a caregiver at all was absolutely so violating.
In total, over 1,150 different patients received this notice telling them that the person in charge of their medical care was an imposter. The woman doing all of this was not a nurse, and her name was not Melanie Smith. Her real name was Brigitte Cleroux, and her criminal history spanned across the entire continent. Brigitte Denise Cleroux was born around 1972 in Ottawa, which is the capital city of Canada. She started breaking the law when she was just a teenager in Gatineau, Quebec, engaging in theft and fraud. In fact, her very first adult criminal conviction happened all the way back in 1988. By 1991, at just 19 years old, she was caught pretending to be someone else and forging, or faking, important documents, landing her in jail for a month. Going to jail did not stop her. Over the next few decades, Brigitte would build a staggering criminal record. She eventually racked up 67 adult convictions in Canada and the United States. She became a master of disguise, using more than 20 different fake names. Over the years, she called herself Brigitte Marier, Brigitte Fournier, Brigitte Claremont, Melanie Gauthier, Melanie Thompson, and Melanie Smith, among others. In the early 2000s, she moved to Florida in the United States. There, she stole a wallet and a doctor's prescription pad. She used the pad to forge papers so she could legally get OxyContin, a highly addictive pain medicine. When the Florida police came to her home to arrest her, she literally locked herself inside a closet, trying to hide from them, forcing the police to break their way in. She also moved to Colorado to go to nursing school, but she never completed her training. She was kicked out after 2 years when the school discovered her criminal past. She learned just enough medical words to be dangerous. Instead of giving up and finding a new career, she just faked her credentials and started working as a registered nurse in Colorado Springs anyway, choosing the job simply because it paid a lot of money. Whenever she got caught, she would simply run away to a new province or country and start over. Oh, and she did not just pretend to be a nurse, she faked her way into many jobs. In 2006, she decided to pretend to be a teacher. A high school in Quebec was desperate for a French teacher, so Brigitte showed up using a fake name and got the job. She had absolutely no training to be a teacher. Her students remember her wearing heavy makeup, tight jeans, and low-cut leopard print tops. Her teaching was terrible. She only taught the most basic French words because she didn't really understand the language well enough to teach it. One day, she showed the students a movie that was so highly inappropriate, they described it as being like an adult film. To make it even weirder, the movie wasn't even in French. When the teenagers felt awkward and uncomfortable, she just laughed at them and asked why they were so uncomfortable. She was also known to be a bully, picking on quieter kids until she finally quit the job. She even managed to run a hair salon. Her former landlord, a man named Bruce Peters, was also defrauded by her. He called her a master of manipulation and deception, noting that she was incredibly good at tricking people. Later, she moved to Calgary, Alberta, and lived with her best friend, a woman named Joelle, who was, in fact, a real nurse. Brigitte constantly asked Joelle detailed questions about her job. Joelle thought her friend was just curious, but Brigitte was actually grooming Joelle to steal her identity. Brigitte eventually took Joelle's birth certificate and a power bill to a government office to get an ID card in Joelle's name. She almost got away with it, but a special facial recognition computer system that matches photos recognized her from an older picture and flagged it as fraud. When the police finally caught up with her in Alberta for faking her identity and working in medical clinics, she was arrested and brought to court. She even handed the judge character reference letters to prove she was a good person. But investigators later found out Brigitte had faked those letters too. She was known to pretend to be her own boss on job applications, giving herself perfect scores and calling herself honest and loyal. Kinda ironic, don't you think? But to find out how depraved this story gets, here's the story of Kayla, a female patient who became a victim of Brigitte's scam. Kayla, not her real name, was scheduled for surgery in May 2021. Kayla had been dealing with endometriosis for most of her life. Endometriosis, for those who don't know, is a condition that happens when the kind of tissue that normally grows inside the uterus starts growing on the outside, in places it shouldn't be, causing extreme pain. Because of this pain, Kayla was scheduled to have surgery to cut out this extra tissue. When Kayla arrived at the hospital, she was ready to get the procedure over with. She was introduced to her attending nurse, a woman going by the name of, yep, you guessed it, Melanie Smith. Kayla later described this nurse as being around 50 years old, very loud, condescending, wearing thick, clumpy mascara on her eyelashes, and having frizzy black hair. Nurse Melanie had to put an IV into Kayla's arm. If you're not familiar, an IV is that tiny plastic tube put into a vein with a needle, so doctors can give patients medicine or fluids directly into their blood. It is a very basic, essential skill that every single nurse must know how to do. But Nurse Melanie kept messing it up. She poked the needle into Kayla's arm over and over, digging around trying to find a vein, but she completely failed. Finally, she had to ask another hospital worker to come in and do it for her. While it was weird that a nurse could not do a simple IV, her behavior was even stranger. At one point, Kayla shifted her body slightly and accidentally bumped her arm against Nurse Melanie's chest. Kayla was very embarrassed and apologized immediately. But Nurse Melanie did not say it's okay. Instead, she started laughing hysterically, grabbed Kayla's hand, and used it to touch the chest she had just accidentally bumped. Kayla was stunned, but she just figured Melanie just had bad manners and tried to forget about it. Other patients had even more terrifying experiences. One patient described how this nurse failed multiple times to insert an IV and then got so aggressive that she used her knees and body weight to hold the patient down. Imagine being sick and scared and having someone pin you down with their knees just to stick a needle in you. I don't know about you guys, but that sounds pretty terrifying. During the violent struggle, the fake nurse accidentally nicked an artery, which is a major, high-pressure blood vessel that carries oxygen-rich blood away from the heart. FYI, nicking an artery can cause dangerous bleeding. Even worse, during the struggle, the fake nurse accidentally pricked herself with the needle. Shockingly, the fake nurse then turned to the bleeding patient and told the patient that they needed to go get an HIV test because the nurse had pricked her own finger. Kayla went ahead with her surgery, but her recovery was not normal at all. Usually, patients wake up soon after this kind of surgery, but Kayla stayed completely unconscious for 12 solid hours. Even after the hospital let her go home, she slept for another 18 hours straight. To make matters worse, she woke up covered in big bruises and marks that the hospital staff could not explain. When Kayla requested her medical records later on, she and her real doctor were stunned. Kayla had been given a bizarre and dangerous mix of heavy medicines, including a strong painkiller called fentanyl. Fentanyl is an incredibly powerful drug that can easily stop a person's breathing if it is not given in the exact right amount by a trained professional. Her doctor had told her that she definitely should have not been given many of those medicines. This fake nurse was doing highly advanced medical tasks. She was in charge of managing patients' pain, doing blood transfusions, checking heart monitors, and giving powerful drugs through IVs. She even worked in the post-anesthesia care unit, or PACU, the room where patients slowly wake up from anesthesia after an operation or surgery. Now, I know this is basically stating the obvious, but this is an incredibly dangerous place to have a fake caregiver. When a patient is waking up from heavy sedation, they cannot advocate for themselves and are completely helpless. The hospital staff is supposed to be their safety net, but Brigitte was essentially playing roulette with people's lives. Even after finally being fired from hospitals and clinics in British Columbia, Brigitte never stopped. She moved back across the country to Ontario. In July 2021, she was hired at Original Fertility Clinic and Women's Health Center and started work there on July 26, 2021. A fertility clinic is a highly sensitive medical office that helps women who are struggling to get pregnant. Note that most patients might already be dealing with massive amounts of stress, anxiety, and expensive medical bills. Brigitte brought a fake resume and completely made-up diploma from the University of Miami to get the job. At this clinic, Brigitte was supposed to draw blood and give injections, but she had absolutely no idea how to do either. She would dig needles into patients' arms, her trademark behavior, apparently, leaving them bleeding and in terrible pain. Sometimes she caused nerve damage that made the patient's arms go numb for weeks. She was deeply cruel to the patients as well, making mean and damaging comments about their ability to have children, which caused many women to delay their critical medical decisions out of fear and sadness. Finally, a real nurse at the clinic noticed how terrible Brigitte's bedside manner was and the way she talked to and addressed patients. Because Brigitte lacked basic human empathy and professional behavior, the real nurse became suspicious and decided to do a routine online search for her. She quickly found a police warning about Brigitte's long history of crimes. When confronted by the staff, Brigitte aggressively shoved a patient's medical chart into a doctor's arms and yelled, "I'm done. Do not call me," before running out the door. Unbelievably though, days later on August 16, 2021, she applied for a nursing position at Argyle Associates, was hired, and worked with at least 12 patients, including a child. She was finally arrested while wearing her nurse uniform, walking back into the fertility clinic on her lunch break to try and pick up her final paycheck. This, along with other stories from Brigitte's victims, shocked the entire country of Canada. Not only because it's the criminal history of a fake nurse, it also exposed the twisted maze of the huge and dangerous flaws that plague the country's hospital system. Now, how does a major professional hospital like BC Women's Hospital end up hiring a criminal with almost 70 convictions? The answer is a terrifying failure in the system, driven by something experts call diffusion of responsibility. This is a psychological term that means when there are a lot of people working in a big organization, everyone assumes that someone else is doing the hard work of checking the rules. Because everyone assumes someone else did the background check, nobody actually does it. People have blind trust in the system. And this isn't to put the blame on anyone in particular, just the fact that it is very hard to keep track of a system when everyone is overworked by it. When Brigitte applied for the job at the Vancouver hospital in June 2020, she did not show a government-issued ID, like a driver's license or a passport. Instead, she handed the hospital a photocopy of a personal bank check. She had literally used whiteout liquid to erase the original name on top of the check and handwrote the name Melanie Smith over it. Unbelievably, the hospital accepted this clearly altered, messy piece of paper as proof of her identity. Furthermore, the Provincial Health Authority never bothered to call her references to see if she was a good worker. Most importantly, they never checked the official nursing registry. If you're unfamiliar, a registry is a giant official list kept by the government that proves who is legally allowed to be in a profession, in this case, a nurse. All the hospital had to do was type the name and license number into the website for the BC College of Nurses and Midwives. If they had done that, they would have instantly seen that this woman was a fake. Because they skipped these crucial safety checks, a dangerous fraud was given the authority to give patients powerful drugs. What Brigitte did was not just a scam, it was physically and legally violent. To understand why, you have to understand the legal and medical concept of informed consent. And I guess the practical and moral concept of informed consent as well. When you go to a hospital, you are supposed to give your consent or your legal permission for a doctor or nurse to touch your body or give you medicine. But consent is only valid if you know exactly what's going on. You have to know the risks, the benefits, and exactly who is performing the procedure. You have to be cognizant of all of it. If the person holding the needle lies to you about who they are and what their training is, your permission is completely, legally void. You did not agree to let an untrained criminal touch you. In civil law, this can be argued as battery, especially because she used needles on them under false pretenses and without their actual consent. During sentencing, the judge made this incredibly clear. Every single time Brigitte stuck a needle into a patient's arm, it was not medical care. Legally, it was considered assault with a weapon because she was stabbing them with a sharp object under completely false pretenses. The patients were deeply violated, forced to undergo the most invasive and private procedures while completely unconscious, entirely at the mercy of an imposter. How could someone do this for decades? Doctors who evaluated Brigitte for her trial tried to answer this question. A psychiatrist named Dr. Floyd Wood from Royal Ottawa diagnosed her with 3 distinct personality disorders: antisocial, borderline, and narcissistic disorders. Another expert also noted historic traits. In simple terms, antisocial personality disorder means a person completely ignores the rules of society and does not care about the rights or safety of others, let alone their comfort. Borderline personality disorder means a person acts very impulsively without thinking and has very unstable relationships. On the other hand, narcissistic personality disorder means a person constantly needs to look important, feels superior to everyone else, and has absolutely no ability to feel sorry for hurting other people, which is known as lacking empathy. The psychiatric report stated that Brigitte was consistently deceitful and had a profound lack of remorse or insight. She did not lie to survive. It seemed she survived to lie. The deception was a compulsion. Dr. Wood noted that while she did not set out with the specific intention to physically murder people, she was so selfish that she simply did not care if her total lack of training put their lives in extreme danger. Dr. Cynthia Baxter, another psychiatrist based in Calgary, said it was rare to see someone continue impersonating professionals for so long, despite numerous arrests and convictions. In an article, she says, "What's often going on in situations like this is that people have this pervasive pattern of grandiosity and this need for admiration combined with a lack of empathy, where they feel like they could just take on a variety of roles because they're so self-important. Things like having to do education or go into a regulatory body. All that is for regular people." The victims of Brigitte's crimes were not just the patients. The real nurse, Melanie Smith, also suffered terribly. Because Brigitte stole her identity, her name was dragged through the mud in the national news. Imagine going to school for years, working hard to get your nursing degree, and dedicating your life to helping people, only to have a criminal steal your name. When people searched Melanie Smith nurse on the internet, stories about a criminal fraudster popped up. This damaged the real Melanie Smith's reputation, caused her immense anxiety, understandably so, and made it incredibly difficult for her to find work. The damage was so severe that the real Melanie Smith actually had to legally change her own name. During the trial, the judge noted that Brigitte had stolen and contaminated that name to the point of destruction. When Brigitte finally faced justice, the courtroom was tense. In April 2022, she was sentenced in Ontario for the crimes she committed there. Then the legal system focused on her crimes in British Columbia. During the BC sentencing, Brigitte stood up in front of the judge wearing all black. Clutching a box of tissues, she read a tearful apology from a white notepad. She said the following: "I apologize to all the patients who were affected directly or indirectly by my actions. My sincere apologies to you all. By pleading guilty, I did so because I was remorseful and ashamed by what I had done. I wish the victims to heal and apologize for being involved in their care when I shouldn't have." However, the judge and the victims did not believe her tears. Her defense lawyers tried to make excuses for her. They argued that she didn't go rogue, meaning she only performed the tasks the hospital assigned her to do. So, the hospital was partly to blame for giving her the tasks. The defense also argued that her crimes were mostly about dishonesty, not violence. The judge quickly shot this down, stating that the entire system of medical qualifications exists precisely because unqualified people are a massive, violent risk to patients. The defense lawyers asked the judge for a lighter sentence of 5 to 6 years, and they wanted it to be served concurrently with the 7-year prison sentence she was already serving in Ontario. In the legal world, concurrent means the sentences run at the exact same time. If a judge agrees to a concurrent sentence, it means the criminal wouldn't actually spend any extra years in jail. The two timers would just run together. But a team of government lawyers prosecuting her strongly disagreed. They asked the judge for a much harsher sentence to be served consecutively. Consecutive, in legal terms, means she would have to finish her 7 years in Ontario and then start a brand new sentence right after, keeping her in prison much longer. Ultimately, she received a 7-year sentence that she will serve in BC, but most of it will run at the same time as her Ontario sentence. The practical result is about 4 or more years after the Ontario time, creating a total prison sentence of 7 years. The judge called her a serial imposter, whose chronic dishonesty struck at the very core of public confidence in the medical system. While Brigitte was sent to prison, the victims did not stop fighting. The emotional toll on the patients was catastrophic. One victim, a teacher, was so traumatized after Brigitte gave her fentanyl 3 times that she suffered from severe depression and had to take time off work, withdrawing from her own family. Another woman shared that she now has to be on anxiety medication and is constantly on edge. To seek justice, a massive class action lawsuit was filed against the Provincial Health Authority. In legal terms, a class action lawsuit is when a large group of people who are all wronged by the exact same thing team up to take legal action together, rather than filing hundreds of individual lawsuits. The patients argued the hospital failed to keep them safe by negligently hiring a fraud. The court certified the class action on the issue of willful violation of privacy. This means that because the hospital let a fake nurse work there, Brigitte was illegally allowed to look at highly sensitive private medical files when she had absolutely no right to see them. However, the negligence, battery, physical injury, and psychological injury claims had to be pursued individually by the patients. The certification was not immediate proof that PHSA was liable. Still, because of this massive embarrassing mistake, the Provincial Health Authority was forced to completely overhaul its rules. According to an official statement by a hospital executive, they now use a strict standardized process. Every single time a nurse is hired, the hospital must legally cross-check the person's name and license number directly with the College of Nurses to make sure their credentials are real and up to date. They cannot simply accept a photocopied check anymore, especially not one with whiteout on it and a name handwritten on the whiteout. Brigitte Cleroux's unbelievable story of endless lies exposed the serious gaps in hiring and credential checks at the health authorities and clinics that hired her. It is a terrifying reminder of what happens when a system designed to protect people becomes lazy, allowing a cruel imposter to hold the lives of vulnerable patients in her completely unqualified hands. In any case, don't forget to like and subscribe, and we'll notify you of more interesting and shocking news in the health world. See you in the next one.